So, nasal obstruction. Nasal obstruction or a typical nose block can be a unilateral nose block or a bilateral nose block, or it can be a shifting unilateral nose block. Shifting in the sense from one side to the other side. Okay. So what are the causes for this unilateral nasal obstruction? The causes for this unilateral nasal obstruction can be in the form of inflammation of the vestibule, inflammation or a bacterial infection of your nasal vestibule. Either one vestibule can be involved where you commonly do a nasal pricking or a nasal picking of the crust. That causes a vestibulitis of the one nostril or both the nostrils. Suppose the patient is a working laborer in a hot environment, then he can develop some crusting of the nose. If these crusts are removed with an unclean hand, that can lead to formation of a vestibulitis. Or because of the involvement of hair follicle or vibrissae in your nostril, that can lead to a furunculosis. Furunculosis is nothing but an inflammation or infection. Most of the times, infection in ENT is because of the gram-positive organisms. The most common organisms involved in ENT is a Staphylococcus aureus or a streptococcal. So the most of the gram-positive infections in ENT are of gram-positive origin. Most common organism involved is Staph aureus or streptococcal. In an elderly adult patient, the other bacteria which can cause the infections involve your Haemophilus influenza. Very rarely the infection is of involving anaerobes. So in nose, in disease of the nose, there is a very little chance that your bacterial organisms involve anaerobic. There is always a bacterial involvement, a gram-positive bacterial involvement, followed by sometimes resistant organisms in the form of, it can be a gram-negative involvement if the disease is resistant, but there is a very little chance, or rather a meager chance to say that there is a anaerobic involvement. Okay, so any infection of a hair follicle can be a furunculosis of the one nostril. Suppose there is an involvement of a neural dermatome. It can be of a herpes virus origin. Or sometimes you have a fracture of nasal bones. These are your nasal bones. Suppose you are feeling crepitus here over your nasal bones. Crepitus is a pressing sense. If you press over the nasal bones, air crackling sounds are here. So that is what you are suspecting, a fracture of a nasal bone. That can cause some unilateral nasal obstruction. Other causes of unilateral nasal obstruction include your antrochoinal polyp. Antrochoinal polyp is of unilateral origin, which originates from the maxillary antrum and proceeds towards your nasopharynx, and in front comes through your nostril. It is most common in children up to the age group of 10 to 12 years, unilateral. Another disease condition where you can see a unilateral nasal obstruction is a conchobullosa. Conchobullosa is nothing but air-filled turbinate. This conchobullosa is most commonly involving your middle turbinate. So whenever the middle turbinate gets pneumatized due to one reason or the other, and there gets a air accumulation because of which the middle turbinate widens, that is what we call as conchobullosa. I'll try to show some of these pictures of these disease conditions in my later slides. And even you can browse the internet, you can give the keywords, you will understand the clinical picture better whenever you are seeing this. Okay. So another disease condition which can cause unilateral sinusitis is an allergic fungal rhinosinusitis. So whenever you are speaking about an allergic fungal rhinosinusitis, you have to always think that it is of allergic origin. So it is something like an allergy to a fungus. This fungus in allergic fungal rhinosinusitis is not life-threatening. Not a life-threatening, but it will cause an allergic inflammation of the nasal mucosa, which will lead to a unilateral nasal obstruction. Rhinosporidiosis, the structure will be seen similar to a nasal polyp, but there will be a oscillations, raised appearances over the nasal mass which you are seeing. The nasal mass is usually grayish blue in color in a case of rhinosporidiosis, and you will be seeing dots, some dots-like structures over this rhinosporidiosis. Suppose the patient is working in a very hot climate, because of which the nasal cavity dries up and there is a formation of crusting, as you see in patient with vestibulitis of the nose. Particularly in hot working condition, working people, adults, that is what we call as a rhinoscleroma. Here the nasal crusts will be typically black in color. Typical black color. Usually if there is a drying of the nasal mucosa, because of the involvement of goblet cells, it is mucoid in nature. This nasal mucosa which gets dried up forms crusts. The crusts will be yellowish, or sometimes if it gets infected with a bacterial or a viral origin, it will be a greenish yellow in color. But in hot working conditions, especially in workers, this secretions which gets dried up, the nasal crusts will be typically in a black color. Foreign body, particularly in a child who is presenting with a unilateral nasal discharge, foul smelling of 1 month or less than 1 month duration, you can always suspect a foreign body. Remember, if a child comes to you with a unilateral discharge, nasal discharge, with foul smelling nature, you can always suspect a foreign body in that patient. And sometimes these foreign bodies, when they are of long standing duration, they get accumulated by certain salts of magnesium and calcium that will lead to the formation of a hard rhinolith, or rather to say a foreign body with a calcified shell is what we call as a rhinolith. This is also again most common in a child. So the causes of unilateral nasal obstruction in a child will be a foreign body, rhinolith, vestibulitis, furunculosis, AC poly. Other causes will be a traumatic, fractures, and a choanal atresia, which is of congenital origin. So this choanal atresia can be a unilateral choanal atresia where one opening of one of the nostrils is not open. Posterior end of the nostrils is not open. Or it can be a bilateral or complete choanal atresia in a newborn. In a newborn child who is struggling to suckle the mother or suckle the milk, and sometimes the baby may turn out blue, cyanosed, you can suspect a choanal atresia in those patients. Or you sometimes suckling difficulty with cyanosis can be a choanal atresia in a newborn. Okay. So let me proceed to the next slide. Alternating nasal obstruction. So sometimes, this is not sometimes, most of the times whenever a patient comes to you with, this will be the most common complaint, alternating nasal obstruction. Sir, today I have a nasal obstruction in my right nostril. By evening, it has shifted to my left nostril, and when I was sleeping, it shifted from my right to left, left to right. It is continuous. Why is this so? It can be a physiological, as in the case of a nasal cycle. This physiological shifting nasal obstruction from one nostril to another nostril is what we call as a nasal cycle. This nasal cycle typically is active if there is an anatomical abnormality of the medial wall of the nose, where it is commonly mostly seen in the form of a septal deviation. If you are suspecting a nasal septal deviation, there is all a chance for alternating nasal obstruction from one nostril to the other. Why is this so? This is so because the turbinates are having function to congest and decongest alternatively. So that is the reason where the nasal cycle operates, and you will be having a alternating nasal obstruction. So the other causes of unilateral nasal obstruction can be in the form of an allergic rhinitis. So allergic rhinitis, most commonly the patient presents to you with nose block, when you with or without sneezes, with or without tingling sensation in the nasal cavity or the oropharynx, especially over the palate, or sometimes itching inside in the ears. So then you can suspect that he or she is a patient of allergic rhinitis. Allergic rhinitis, itching in the nostril, itching in the ears, itching in the palate, with or without sneezes, with or without nasal obstruction, with or without headache, with or without sneezes. Okay. Suppose the patient is presenting to you as with vasomotor rhinitis. Suppose you are suspecting vasomotor rhinitis. Then there will be a profuse nasal discharge in these patients. There can be an irritable headache. But the nasal obstruction and the sneezes, especially the sneezes, will be limited. there will not be much of the sneezes. So this is, so to differentiate a vasomotor rhinitis from an allergic rhinitis, allergic rhinitis characteristically will have itching with most of the time sneezes. Whereas vasomotor rhinitis will not have itching, will not have sneezes. So, but there we will, the nasal secretions are most common for the both. So this is how you say that the patient has got either an allergic rhinitis or a vasomotor rhinitis. Remember, due to the in both the conditions, there will be a congestion and decongestion of the nasal mucosa, which leads to operation of your nasal cycle. So the other disease condition which develops secondarily due to the anatomical abnormalities of the nasal septum will be your sinusitis. So sinusitis can be a sequelae to an allergic rhinitis, where there will be a remission of symptoms for a short duration of time, or your vasomotor rhinitis, or your anatomical abnormalities, which include your deviated nasal septum. So these conditions can precipitate sinusitis. Rhinitis. Rhinitis is nothing but a common cold. So whenever you are experiencing a cold, on day one, you will have a burning sensation in your nostril. So this burning sensation within your nostril is because of exposure to this bacterial or viral forms. So whenever there is an inflammation which is set up because of this foreign material of either a bacteria or a virus, the initial inflammatory response of the body, of the goblet cells and other cells present in the nasal mucosa, they will cause an initial edema which leads to a watery secretions from the nostrils. So on day one of common cold or rhinitis, you will have an initial watery or secretions. So you sleep off, you wake up the next morning, you see there is crusting around your nose. This can be because of your goblet cells secreting mucus in response to the foreign material. So during those times, the burning sensation in the nose or the nostril comes down. Nasal obstruction increases profusely. Nasal discharge increases. This discharge gets thickened and mucoid in nature. So this is stage 2 of rhinitis. So stage 1 of rhinitis, secretions will be of fluidic origin, watery origin. Stage 2, thickness of the secretions increases. And during the stage 3, that will lead to either a resolution of clinical symptoms. Symptoms will come down because of your medical management or your symptomatic management, or the symptoms may proceed and lead to your complications. So there will be a nasal obstruction in a patient with rhinitis because of development of inflammation and then the development of these thick secretions which will block again your nasal cavity. So that deviations of the nasal septum, which is an anatomical abnormality, will cause a unilateral or nasal or a bilateral nasal obstruction. So these are the causes for alternating nasal obstruction. I know I'm going very bit slow today because of your suggestions. You can give me a final feedback at the end of the session if you are comfortable with today's session, or you want me to a bit speed up the session, or you want it still more slow. So the causes of bilateral nasal obstruction, as usual, again the vestibulitis of the nose, the pharyngolysis, herpes. Remember, their unilateral nasal obstruction is common with antrochoanal polyps, whereas the bilateral nasal obstruction, the ethmoidal polyps cause bilateral nasal obstruction. Ethmoidal polyps, they do originate from your ethmoid sinuses. You have two pairs of ethmoid air cells, another two groups, anterior ethmoids and posterior ethmoids. Both of these anterior and posterior ethmoids get involved in patients with ethmoidal polyposis. Okay? The other thing will be your concabulosa, which is a pneumatization, rhinosporidiosis and rhinoscleroma. These clinical pictures will be shown shortly when I am proceeding with the topic. You have to bear with me. I have received one suggestion to share the pictures. Bear with me for a few more minutes. You will see the pictures. Then comes the foreign bodies in both the nostrils in immunocompromised patients, where you can see bilateral nasal obstruction, rhinolith similarly. And another interesting point which can cause a bilateral nasal obstruction is an adenoids. Adenoid, which is present in midline of the nasopharynx, can block either one nostril or the other, or both the nostrils. So that can be cause for your bilateral nasal obstruction. Suppose you have removed the tonsils. Let's assume a situation that you have removed your tonsils, which will be in your tonsillar fossa, or rather your palatine tonsils are removed. So because these tonsils are a part of Valdeir's ring, which you will understand during my session in the month end, where I will be speaking about the clinical discussion of the oral cavity and oropharynx. So you have removed the palatine tonsils, and the tonsils are a part of this Valdeir's ring, and because of which the other tonsils in either the base of the tongue, which what you call as a lingual tonsillar hypertrophy, may swell up, causing a bilateral obstruction, nasal obstruction. Or you have incompletely removed the adenoids and removed the complete palatine tonsils. Again, these adenoids can swell up. That can lead to a bilateral nasal obstruction. Okay. So the other causes of bilateral nasal obstruction includes obstructive sleep apnea and a septal hematoma, along with tumors of nose and paranasal cells. Septal hematoma, which is again a collection of fluid in between your septum and the pericardium. Okay. So I have been asking you about pictures, intermittent, persistent. So that was one classification. How do you classify nasal obstruction? The other classification will be an intermittent nasal obstruction, where it will be of a short duration and gets relieved. So intermittent nasal obstruction is characteristics of allergic rhinitis and ethmoidal polyposis of allergic origin. Okay. So some pictures are missing in these slides. I'll try to show that I'm continuing the same during my tomorrow session again. So persistent nasal obstruction will be because of your allergic rhinitis and vasomotor rhinitis, or with your deviated nasal septum. Okay. So this is one more classification where you classify the nasal obstruction as intermittent and persistent. Okay. So when you are classifying this nasal obstruction based on the age of the patient, so the disease conditions which are common in children will be your foreign bodies, AC polyps and adenoids. Adolescents, a bleeding polyp which you call as a nasopharyngeal angiofibroma, which is characteristic of an young adolescent male. Only disease which affects an young adolescent male child is a nasopharyngeal angiofibroma. Till date, not much of cases of nasopharyngeal angiofibroma are seen in female patients. Not even this disease is not even characteristic of adults also, or rather the children below the 10 years. Only the young adolescent male child shows a nasopharyngeal angiofibroma. So the other causes in a adult will be your ethmoidal polyps, allergic rhinitis, vasomotor rhinitis. The overlapping allergic rhinitis and vasomotor rhinitis is common in child, adolescent and adults. Ethmoidal polyps is characteristic of only adults, not in a child. Anthracoinal polyp is characteristic of a child, not in an adult. Adenoids can be seen in children and adolescents, not in an adult. Nasopharyngeal angiofibroma is characteristic of only adolescent male, never in any other age group or even in an adult you will see that. The other age group, elderly age group, malignancies are most common whenever you are dealing an elderly age group. Remember, first you have to isolate or identify and rule out a malignancy before you proceed to the other causes of your nasal obstruction. Remember the other causes, how you will identify a nasal obstruction. I'll keep this slide. I'll break for 3 minutes. Then again ponder you with the other causes of nasal obstruction. So till today, till this minute, I have been just introducing you to the topic about nasal obstruction only. I did not proceed beyond. I'll just break for 5 minutes and we will rejoin again. Relax for 5 minutes. Hello. Are you there all? Yeah, hopefully you will all be there. Let me continue the session on nasal case of a nose, how you will be taking. Most of you are interested in jotting down, so I'm going very slow today. So I'm enumerating how you are supposed to deal a case of a nose. So whenever a case of a nose comes to you with, you are supposed to deal it in the form of a nasal obstruction, discharge, sneezes, headache, facial pain, trickling in the throat, bleeding from the nose, snoring, and loss of smell sensation. Most of your feedbacks are interested in jotting down and understanding, and secondarily the pictures. So the pictures I have postponed to my tomorrow session. Today I'll be dealing, mostly I'll be finishing off the nasal obstruction and if possible, a few more nasal discharge and sneezes. Beyond that, I think most of the sessions will go beyond tomorrow.